Hello and welcome to my 15.2 Physiological Responses to Common Sports Injuries by Edward Sayers. So first of all, what we're going to be looking at is sprains. So there's three types of sprains that a person can sustain during sport. The first is a grade 1, which is titled stretching sprain. So if someone has stretched an ankle, for example, then they still have stability in their ankle and it's still movable. So they've stretched the joint further than its acceptable range of movement, which is why the injury has occurred. The second type is a grade 2, as you can see from the diagram here. So this is called a tear. So if a person has torn their ankle, then they have minimal to no stability and minimal movement of their ankle, for example. Part of the muscle has been torn apart. This could be done by landing awkwardly or possibly changing direction quickly within a sport like basketball. The last one is the most severe type of sprain, which is a rip, as you can see in this diagram here. So if a person has ripped their ankle, then they have no stability and will have no movement. It is separated from the joint or other muscles. This could be done by lifting too much weight in a gym with a dumbbell, for example, when eccentrically contracting the dumbbell back down. And then this can actually cause your muscle to rip apart from each other. Okay, and the second thing we're going to look at is strains. So again, like sprains, there are three types. The first one is a pull, which as you can see in the diagram here is like this. So this can be caused by overstretching or overexertion, or possibly not warming up properly. If someone suffers a strained muscle, then they have damaged either 10% or under muscle tissue. So there's minimal tension and minimal movement from this type of injury. The second type is a muscle tear, as you can see in the diagram here. So this can be done by not warming up properly and then stretching very far in sports. This could be like not warming up properly and then really lunging in for a tackle in football, for example. Or it could be done by landing awkwardly in a sport like basketball, where you jump up for the ball. A tear can damage between 10 and 15% of muscle tissue, and with this there's no tension or no muscle movement available. And then the last one, as you can see here, is a rip where the muscle is completely separated from each other. So this can be done by a high impact tackle or heavy collision tackle. For example, if someone was running full pelt at you in rugby and collided into you like that, that can lead to a ripped muscle. This can do between 50 and 100% muscle tissue damage, and again there is no tension and no muscle movement available if someone suffers a rip. Okay, now we're going to move on to what are called hematomas. So there are two types of hematomas. The first one is an intermuscular hematoma. So this is a localized collection of blood inside the blood vessels due to either disease or trauma, including injury or surgery. So what this does is it's an injury and the blood stays where the injury has occurred. So it stays local and doesn't spread to any of the nearby muscles. So it stays very much where the injury happened. Then, as you can guess, an intramuscular hematoma is the complete opposite. So due to either disease or trauma, including injury or surgery, this does not stay local to the area of impact. Blood spreads to the surrounding areas of muscle, which leads to bruising of the area across the individual's body. So this could be a pectoral injury, and it could spread all the way down to the stomach, even to the back and down the arms if the injury is so severe. And also, just a side note, individuals who suffer from the condition haemophilia are especially susceptible to intramuscular injuries, and they can spread very easily and so severely that small impact injuries can actually be fatal. Okay, now we're going to move on to the blood clotting mechanism. So this is broken down into 4 stages, and as you can see there's a diagram here to help your understanding. So stage 1 is where platelets will block the wound at the epidermis, which is the top layer of the skin, acting as a plug. And blood vessels vasoconstrict to reduce blood flow. So as you can see by the diagram here, the platelets are the greyish blobs, so they act as a plug to block up the opening. So the second stage is clotting factors fill in the gaps of the wound. The clotting factors are little red circles in between the platelets. Then the third stage, fibrin, which is one of the clotting factors, acts as glue to stick the wound together. So as you can see here, fibrin is the yellow web going across the top like that. And then stage 4, other pathogens such as white blood cells and red blood cells go to the wound to block up any gaps left over and fight any infections that might have entered via the breach in the epidermis. So I know it's not very clear here, but the little green dots are the other pathogens that work to heal this opening in the epidermis. So over time, as the wound heals, the blockage of all the minerals dissolve into the bloodstream, leaving a scar and 50 to 80% of the original strength of wherever the injury has occurred. Okay, now moving on to the 3 stages of healing. So the first stage of healing is inflammation. So this is the emergency response of the body, and it attracts fibroblasts, which limits the flow of fluids and protects the injury, which then allows the process of repair to start. And then repair, depending on the location and severity of the injury, repair can take for between 4 weeks and 3 months to fully recover. And then the final stage is remodeling, and this can take years for an injury to fully remodel, depending on the injury location and severity. So here I've just drawn a quick graph so you can see the length of time in relation to the injury. So the red one here clearly is inflammation. Then the blue one, so it's less of a rapid response, but it does take a longer time than inflammation, is the blue line. And then lastly, this green line here represents remodeling. So what I've done here is shown that the response of the remodeling phase isn't instant. However, because it goes off the graph, this is supposed to represent the long duration of the remodeling process. Okay, so now we're going to move on to the psychological responses to common sports injuries. So when someone sustains a sporting injury, they will go through grief, and with grief there's 5 stages of it. So the first is denial. So denial can be experienced when an individual discovers that they have sustained an injury. The first stage of healing is what they will experience. In the first stage of healing, they will experience denial, which is a normal reaction to rationalize their overwhelming emotions. It is a defense mechanism that buffers the immediate shock of the news of the injury. People block out words and ignore advice and hide from the truth. This is a temporary response that carries people through the first wave of pain of an injury. At the root of denial is actually fear and being afraid to admit the truth that they're actually injured. And the second stage of grief is anger. So anger comes after denial wears off and the reality of the pain re-emerges. People are not ready, and the intense emotion is deflected off a vulnerable core, redirected and expressed as anger. Anger can be aimed at anyone or anything. Anger can also become especially apparent if the injury sustained is a reoccurring injury. So perhaps an athlete has only been back for maybe a couple of games and they've re-injured themselves just as they did previously. This can lead to athletes becoming seriously angry at the reoccurring injury. Okay, so the next stage is bargaining. So the reason why people bargain is because they're dissatisfied or disgusted at their current situation or offer. The normal reaction of feeling helpless and vulnerable is often a need to regain control. So people might be thinking in a stage of bargaining, if only they'd gone to see medical attention sooner, if only they trained harder, if only they played differently, maybe thinking they'll train extra hard in future to make sure this doesn't happen again, or maybe they'll even be thinking if they just tape it up, then it'll be fine, so they can just play through the injury. The next stage of grief is depression. So confrontation of reality, realizing and understanding the consequences of an injury. This could make the individual unsure of the uncertainty of their future. It can also lead to isolation of an individual within a team sport and can lead to someone actually feeling depressed. Tension and helplessness are generated as individuals become frustrated at not being able to continue as normal with their training or playing. The isolation from the injury causes the normal routine from the team. And can become difficult for someone to accept this. And the last stage of grief is actually acceptance. So acceptance, the individual starts to move towards admission of the injury and adaptation of their lifestyle whilst injured. Their focus is then turned to rehabilitation and returning to their sporting life. The stage tends to mark a transition from an emotional stage to a coping stage, as the individual realizes what needs to be done to aid their recovery. Okay, so now we're moving on to the 9 emotions of injury. So one of the first emotions that an athlete might feel is fear. So this can be experienced when finding out the diagnosis of their injury, or fear of playing through the injury with the fear of making the injury worse. As you can see here, fear starts up here. Then we move on to anxiety and stress. So this could be worrying about the severity of your injury, or worrying before and during your diagnosis as to what it might be, or possibly the fear of sustaining a reoccurring injury. Next, moving on to frustration. Frustration of sustaining injury. So once you're actually become injured, then you'll be frustrated at that, or frustrated at being told how long you're supposed to be sitting out for, and especially feeling frustration if you have sustained a reoccurring injury. Next, moving on to denial. So being in denial of your actual injury, so trying to play through it, or if you're told by a doctor that you're injured for 3 weeks and then you try and come back after a week, that's technically denial because you're just disregarding their advice because you're in denial of the severity of your injury. Next is isolation. So during recovery, being away from your teammates, you might feel alone, especially if it's been a routine of your life for a very long time, and then all of a sudden not being able to do it, it might make you feel quite isolated and away from others. A lack of motivation. So you might feel as though you're not as good, so therefore you need to remotivate yourself. And a lack of motivation to carry on once sustaining an injury in a game. So you might be thinking, like, what's the point because you're injured? So that shows a lack of motivation. And during recovery, you might be too impatient that you lose motivation. So if an injury is taking too long to heal, you might lose motivation and you might not really want to play the sport anymore because you're fed up with your injury. Next is low confidence. So this could be during your first game back or first training session back after an injury. You might be very, very low on confidence because of your injury, and you've just got back and you don't want to re-injure yourself, so you might be going quite light in the session. Then moving on to anger, as you can see here. So this is when sustaining the injury, the frustration that you can't actually carry on in the game, potentially. Anger when finding out the diagnosis. So if you find out that you're injured for like 3 or 4 months, then that could really anger some individuals. And anger when at home recovering and not being able to play the sport with your teammates. That might anger some other people as well. And then lastly is depression. This could be when subbed off because you can't continue. After diagnosis, like with anger, if you find out that you're injured for a very long time, then you could become quite depressed over this. During recovery, you can become depressed as well because you feel away from everyone else and your teammates that you might have been with for a very long time, and now you're not able to be with them as you want to be because of the state of your injury.